Hello everyone. Today we will be talking about Humana's Medicare Advantage Plan for Education Minnesota. My name is Todd Goldrick. I am a sales manager in the state of Minnesota. I've been working with Humana now for 10 years and pleased to be able to offer this to our retirees. We're going to be walking quite a bit today. You'll see there the 4 different mile marks. We're going to be talking about some of the healthcare decisions and what you need to know. Tim did a great job of talking about the A, B, C's, and D's of Medicare, so I'm not going to really touch too much on this slide here, as Tim did a wonderful job with that. Just a little bit about Humana. So if you see there, we've been in the business for over 50 years now. We started off in the hospital business, and then we got mostly into insurance in the early 80s. Currently, we have about 6.9 million Medicare Advantage members across the entire states, in all 50 states. The nice thing to know about that is if you travel, Humana is going to travel with you. So we have a nationwide network. If you're a snowbird, our plan works wonderful for you. As you can see there, we're going to give you one card that does everything. So we're going to give you the drugs, the medical, the dental, vision, and some other things I'm going to talk about basically into one card. So we make it very easy for you. One of the things at Humana that we are focused on is improving our communities. We want to basically increase the health of by 20% by 2020. Being that we have so many members with us, I think this goal is feasible. Some of that stuff, how we're going to do that, is basically what we offer you in our plan, like a gym membership at no additional cost, some of the over-the-counter items we give you, rewards programs for just doing your preventive measures. So a lot of those things you'll see are going to help towards that goal. So our plan today that we're going to be talking about is a PPO, stands for Preferred Provider Organization. Again, a PPO provides flexibility, so you can go in and out of network. You do have that freedom to go out of network. However, you do pay for that freedom. So you'll see a little bit higher co-payments and deductibles if you choose to go out of network. However, there is a max amount of pocket that you could ever spend if you choose to go out of network. So that's a reassurance if you do have to go somewhere to a specialist in maybe a different state. So let's talk about the plan details, the benefits. So what you will pay, again, $66.43. So with that, and that again includes the medical and the drug coverage. The hospital care, if you go straight across there, you'll see outpatient hospital visit is $450. If you go out of network below there, you'll see is 50% after you meet the $1,000 deductible. But however, $450, that's all inclusive, so that's everything if you had a same-day surgery. If you actually went to an ambulatory surgical center, it could be as low as $300. So it's good to choose to know your options when that time comes. We can actually save you some money. Emergency room is $75, and if you are admitted into the hospital, you'll see there's $354 days 1 through 5. Again, all inclusive, so it covers everything while you're in their hospital. After 5 days, we're going to pay 100%. So your non-hospital care, your primary care physician, you pay $15 to a specialty $45. And there's again that surgical center, which I already touched on there, at $300. Durable medical equipment like wheelchairs and oxygen would be 11%. Going down below, there's this other plan information. There is no deductible if you go in network. So we have a large network of providers. Sanford, Essentia, Mayo Clinic, Part Nicola, Fairviews, North and Morrow, Alina Clinics, just to name a few. So we have a broad range of network. OTC benefit, that stands for over the counter, so you can get items that you would just get at the local pharmacy. So things like minerals, aspirins, toothbrushes, Band-Aids, blood pressure meters, digital weight scales. Humana's going to give you $20 a month, and you can spend it on our catalog up until $20. If you spend over $20, well, then you just pay the balance. But we're going to give you $20 a month, and you can spend it however you want in the catalog that we'll provide to you. You send it through Humana's pharmacy, and we're going to send it right to your front door with no shipping and handling. We also are going to give you dental and vision for 2016. The dental and vision includes some cleanings. It covers 4 different types of x-rays throughout the year, unlimited extractions at 25%, and much more. The vision gives you that routine eye exam at no cost. It also gives you a $100 allowance towards your eyewear. And then the annual maximum out of pocket there is $5,900. That means that most you could ever spend in co-payments would ever be was $5,900. So it's a great protection, so you wouldn't lose the farm if something happened. Below that you see $10,000. That's if you choose to go out of network. You still have a max that you could spend if you had a really bad year at $10,000. So again, a lot of flexibility. With that, the Part D, again, we'll get more into specifics here. Again, Tim did a great job of explaining the donut hole and all that goes into that. So again, remember this plan includes the drug plan included in that $66 premium. So let's talk about that. Now this plan does have a top here. It has a $360 deductible. However, that excludes Tier 1 medications. So if you take a Tier 1 here, you'll see on the left-hand side, at the retail pharmacies up at top here, it's a 30-day supply. Down below says if you use a mail order delivery, a 90-day supply. So if you choose to go local pharmacy, you'll pay up to $9.50 for that medication of Tier 1. Again, no deductible on that. For Tier 2, you pay $47. For Tier 3, you pay $100. And Tier 4 is 25%. Down below, if you use our mail order pharmacy, it's called Humana Pharmacy. It's a great pharmacy, and J.D. Power just ranked as one of the highest on deliverance and customer satisfaction. If you take a generic drug, you pay absolutely nothing for that medication. So that's a wonderful benefit that a lot of people are coming to Humana for that reason. So you pay $0 for a 3-month supply of your generic drug. You pay $131 for the Tier 2 brands, $290 for the non-preferred, and then specialty just remains at 25%. And then we just give you some examples of what some generics would be, some preferred and then non-preferred drugs would be. So really, again, I can't stress enough how important that is to have a $0 co-payment for your medications. They are very accurate, and safety is our number one thing when we focus on deliverance. We have two pharmacists, checking every order. Convenience, you can do it online, you can do it through the phone, or your doctor can submit the scripts to us, but the convenience is they come right to your front door, no shipping and handling, and yes, they even will deliver diabetic insulin. So again, it's just a really good pharmacy system. If you have trouble, you can actually talk to a pharmacist or pharmacy tech. Included in the plan, we always say it's a lot of things that we cover for when you're not sick, and that is Silver Sneakers. It's a gym membership at no additional cost. You check your local area. If you go to silversneakers.com, you can check in and see what area our locations are covered near your home. If you travel, that benefit's going to travel with you. We also give you Humana rewards if you complete 4 preventive items such as mammograms, flu shots, colonoscopies, just to name a few. And if you do 4, you will get $50 in gift cards to retail locations like a Best Buy, Applebee's, gas stations. So it's just we're rewarding you for doing some preventive measures. And again, that's all included with your plan. Understanding your plan. So each month we're going to send you a smart summary. It gives you a detailed list of what your RX costs are for the month. We also give you a breakdown of your medical costs for the month and keeping a running yearly total so that you can see how close you are to getting to the donut hole or the coverage gap. We actually sometimes will predict if you will or will not hit the donut hole based on your current medication. So it's a great document that can keep track for you so that you don't have to worry about that. Also with this, you get My Humana. It's a great online tool that you can access all your benefits, your claims. You can find in-network doctors. You can find in-network dentists. Also on top of that, we give you Humana First, which is a 24-hour nurse hotline. You can call if you're not sure if you should go see a doctor or not. Call the nurse hotline, and they can tell you what the best solution would be in that situation. So what's next? Obviously, you don't need to show your Medicare card. You just show our card. Again, when you go to the pharmacist or the doctor or the hospital, you just use that one card. Again, easy. We have agents that are available to come sit down with you who are educated and trained on the Education Minnesota plan. They can sit down in your home at the local coffee shop and explain to you in more detail all the co-payments, all the premium, all the extra things that we give you, and just to help you guide you on making that decision. So frequently asked questions, I won't go through all these here, but I think Tim did a good job of covering these. Again, my name is Todd Goldrick. You can reach me at 651-231-3251 or reach out to Tim, and we'd be happy to sit down with you and talk about Humana. Thanks, and have a great day.